Hi, this is Don Sharp. I'm with OBR, and I'm here with Dr. Lucio Gordan. And Dr. Gordan is a hematologist-oncologist in Florida. And today we are going to talk about EMRs, and specifically oncology-specific EMRs and how they're used in Dr. Gordan's practice. Dr. Gordan, nice to see you today.
Nice to see you, Don. Thanks for having me here today.
Can I ask first a little bit about who you are and your interest in EMRs? How did this come about?
Right. I'm a medical oncologist and hematologist for the last 10 years in private practice, and we joined Florida Cancer Specialists about 3 years ago. Before I went to medical school, I used to write some software for nephrology, and that's why I got excited about computers and software design, and eventually I decided to go to medicine and always try to apply software design in medicine. And when I joined Florida Cancer Specialists, there was an opportunity to try to enhance what we can do in terms of electronic medical records and data and other issues related to informatics.
You're in a very forward-thinking area in medicine, I guess. And for our audience, what I'd like to do is put it in perspective. Can you give me a little description or characterization of Florida Cancer Specialists so we can understand how the EMR works in there?
Right. So Florida Cancer Specialists is the largest physician-owned practice in the country. We are in about 170 physicians, 100 plus extenders, nurse practitioners, and we have 70 clinics in the state of Florida. And we are totally automated with electronic medical records, so everything from patient check-in to chemotherapy orders to laboratory studies to ordering imaging, and anything you can think of in the practice of medical oncology and hematology is done via oncology-specific EMR.
Okay, so a big practice and a growing practice, from what I understand. When new practices come on board, new physicians come on board, and they're not necessarily on the same EMR, and are there compatibility issues, and does everybody go into the same EMR?
Don, that's an excellent question. So at the end of the day, everybody will be using the same EMR for obvious reasons. We need to be all compatible. We need to have a regular mainstream of data, and the way we proceed from day to day in all practice should be the same. So whenever a new practice joins, we either try to create an interface from their EMR, either oncology-specific or oncology-not-specific, and try to import all the necessary data to our current electronic medical records. We have incorporated practice which were totally electronic, like my practice before we joined FCS, and we have incorporated practice that are all paper-based, and there's obviously a learning curve to get all the physicians and practitioners into the EMR culture. But after a few months or several weeks, everybody is definitely happier and much more productive, and it's a clear pathway to success, in my opinion.
Yeah. So the EMR just begins to grow in its importance within the practice, and maybe a little bit about the evolution of the EMR. I mean, what are some of the things that are the features that are important to you? How has the EMR evolved recently, and everybody's become more dependent on it? What are the things that how are you using it as a tool in your practice?
Yes, very good. So EMR, an oncology-specific EMR, it's extremely helpful because every single order you put in, it's done via either order sets that you have created for the care of your patients. Let's say you're doing a workup of a patient with anemia, or somebody with a hypercoagulable disorder, or a bleeding disorder, or a cancer-specific disease. So we have order sets that help the physician or the practitioner come up with the specifics in terms of the diagnosis of that particular disease. Another thing that we have available is all our chemotherapy regimens are into a database that is updated constantly using all the most recent NCCN guidelines and ASCO guidelines. So there's a chemotherapy pool of regimens that the physician can tap into, and so everything's automated. The regimens and the laboratory studies, the radiology studies, the follow-up. So it's very very helpful indeed. We have procedural templates for, let's say, bone marrow biopsy. That's something that hematology oncologist performs all the time. So that's very important. We have specific alerts in oncology that pops up a screen if a patient has a low absolute neutrophil count, or if we have elevated calcium, or if there's a change in renal function. So there are many things that we have that are specific for the use of oncology that enhances the patient's care, our effectiveness in delivering the best care possible. And finally, one thing that we are developing lately, Don, is patient portals. So our patients are able to look into their own medical records, into their own appointments, and they also feel empowered about getting more involved with their own care. There's more knowledge that is distributed around as everybody gets more involved. So it has been a tremendous success, I think, in the practice of oncology in the last several years.
And you mentioned that everybody in the practice is in tune with the EMR, meaning, as you describe, a patient comes in and their stage, and other practitioners within the practice can view the information on that patient.
Yes.
And act accordingly on it.
Yeah, so you can you can enter orders from any place in the world. Like we have a cloud-based system that allows us to enter orders via an iPad 5,000 miles away from the practice. And you can retrieve records and images and results in real time. You can communicate or forward specific results to specific physicians if necessary. So it does enhance the day-to-day operations. As I say, it has been a quantum leap in terms of efficacy and safety for the patient. So it's extremely encouraging to be involved in the development of oncology-specific EMRs.
And if a patient is hospitalized and you're in the hospital with the patient and you only have your phone with you, you can access their information?
Yes, you can. With the phone, we are, it's not as easy because the phone is relatively small. You can use a Citrix system or a cloud-based system using whatever browser you have on your phone, but most of the time physicians carry a small iPad or a similar or a regular iPad, or most hospitals have computer terminals every single corner these days, so you can open any browser and access the information immediately.
Right, good point. It sounds as though, and I would expect Florida cancer specialists to have a very oncology-specific EMR, which I guess is, relatively speaking, one of the more recent evolutionary steps, and also one of the more important, right? Are there still some people calling you up or practices asking you because they don't have oncology-specific EMRs?
Yes, we get calls and emails and requests to give opinions about oncology-specific EMRs relatively frequently. And in my opinion, there's a large difference between a non-specific EMR versus an oncology-specific EMR, and I lived life before and after in both systems, and I can vouch for this from a personal level. So yes, we get frequent calls, and what is the best EMR? How does this impact your practice? Does it help with clinical trials? And the answer is yes. We're trying to connect, for instance, our clinical trials network and all the menu of regimens we have, and try to merge them with our robust EMR. So everything seems to fall into place when you have a specific product, in my opinion, so we can deliver the specific outcome to the patient.
Yeah. Well, listen, I don't want to keep you anymore. I really appreciate your time and your information, your perspectives. And I hope we get a chance to talk a little more and dig a little deeper into the oncology-specific EMR and the applicability within your practice.
Absolutely. Thanks for having me, John.
Thanks very much, Dr. Gordan.